In this case of typical Asian nose, we encountered an additional problem of the settling of the dorsum because of trauma, and we did not have any definition on the dorsal profile. But there was also something else which cannot be shown in this picture easily, and that was the wide inverted V deformity here, the discrepancy of the level between the upper lattice and the nasal bone stump. Usually in these cases with this very short height of the nasal bone, it's very controversial to touch or not to touch the nasal bones here. And as we all know, this is a risk of collapse if we touch it. So it was a deal, it was a challenge. When I went in, I saw a very short stump of the nasal bone here, but using piezotone device, using ultrasonic cut, I was able to cut through the nasal bone from here to the level of near medial canthus, not exactly to the medial canthus level, and also performing a partial median osteotomy and transverse osteotomy in order to bring it back to midline a little, because we did not have the ability to compensate this discrepancy just by diced cartilage and fascia as the graft to the dorsum or the spreader grafts because of a very low level of the dorsum. So it was possible to bring it back to midline much more than this without a collapse of the nasal bone. It was attached here by green stick fracture, and the stump of the caudal border of the nasal bone was just brought to midline. The diced cartilage prepared from the 6th rib of the right side, now ready for creating the diced cartilage and fascia graft. Now, at the end of the case, the dual effect of both performing the osteotomy in the nasal bones, the lateral osteotomy is performed here, as I mentioned, with piezotone device, plus putting the diced cartilage and fascia as the augmentation graft here, has made a better contour on the dorsum, and the level of the dorsum is also, the height of the dorsum is corrected to some extent in comparison to what it was. But the osteotomy has also helped reaching this result. Of course, this is a partial correction, not complete correction. Also, still we do have some sort of concavity on the dorsum, but the level is brought up at least 7 to 8 millimeters. The nasal tip structure is also reconstructed completely with the strength to keep it stable long term. This 2 weeks after surgery, the extent of augmentation has rebuilt a gentle curve on the dorsum, and we do have also a straight midline positioned dorsal profile.